Hi, everybody. It's Jessica DeMassa with What's the Future of Health. I am talking to the who's who of health tech and healthcare innovation. And today we are doing some deep dives on some digital health and health tech trends with an investor and an analyst and an entrepreneur. So everybody please meet Larry Leisure. He co-founded Jiff, which got acquired by Castlight. He was a co-founder of the Employer Health Innovation Roundtable, founder and managing partner at Chicago Pacific Founders, and he worked at KP at one point. I mean, Larry, this background, I can't wait to dive into this stuff with you.
Look forward to it.
All right, let's start at the tippity top here and talk about these digital health funding deals that we've been seeing over the past year and a half. So $14 billion into health tech in 2020. We're seeing crazy numbers again this year, $6 billion just in Q1 alone. So talk to me about this. I mean, you've been around for a long time. Like I said, the business you founded got acquired by Castlight. So a lot of people look back at that era as like the heyday of health tech. Are we in the next heyday, or are we in a bubble that's waiting to burst? I mean, what do you think about all this?
I think we're just starting. When you look at the overall size of the global health economy, the numbers kind of pale in comparison to the size of the global economy. I think the digital transformation, I think we had the first stage and we're learning, but I think we're really seeing a very rapid acceleration, particularly when you're introducing things like AI, machine learning. So it isn't just shifting, from physical to virtual. It's really how do we use data? How do we use information? And I think that's just accelerating. So I think that you're going to continue to see big numbers this year and beyond. So I think the party is, or to use the baseball analogy, I'd say maybe we're in the third inning, but we're certainly not in the seventh inning.
All right, early innings we're hearing from you.
Yeah.
Do you think that this time around things are different than the way they were before? Like, do you think things are more sticky this time? Because I feel like every time we end up in this, technology is going to disrupt healthcare. And a lot of people don't like the word disrupt. But I think, coming out of this year with the pandemic, the gains that were made with virtual care, with some of the companies that have scaled up in health tech, digital health, and gone public. I mean, I think the Livongo Teladoc deal, $18.5 billion on that deal. I mean, that was significant. So, I mean, talk to me about, what maybe looks different to you this time around.
I think it's different. If you go back to the early days when Epic was first being implemented at Kaiser and it was just getting its legs, there was a certain amount of trust that I think George Halverson at the time talked about being the analog, being the freeway system. When they built the interstate highway system, that once that was built, all these wonderful things that happened. I think digital health got a little bit of a free pass early on. I think what's different now, the expectations are higher.
Okay.
Show me the money. And I think that the bar's higher. I think the investors are smarter. They want to know how is this actually going to improve care? How's it going to take cost out of the system? How's it going to help me be a more efficient, leaner operation? How's it going to help me deliver care to the underserved, where you got to do it at a demonstrably lower price point? So I think the expectations are higher, and entrepreneurs have to be smarter about demonstrating ROI. They have to be a lot smarter talking about workflow. So how is their solution going to integrate into the payer or employer or health system workflow? So I think it's people are getting more sophisticated, but the entrepreneurs are getting more sophisticated. So, and the investors are getting smarter. So I think things are just accelerated. So I'm actually quite.
The investors are getting smarter, if I don't say so myself.
Absolutely.
I want to hear about what you've got your eye on, but I want to hear about your thoughts on some of the pushback that's been coming out recently about digital health. So it seems like, as much as there is enthusiasm for a lot of these health tech startups, sure, there's equal amount of criticism, right? So it's I remember even last year, the last JP Morgan, which was JP Morgan 2020, it's from CNBC. Chrissy Farr publishes this article about how confusion about what digital health even is going to hold back the sector. And then it's now here we are, fast forward a year and a half later, and the Wall Street Journal is talking about how there's digital health fatigue among employers who've got to deal with all of these disparate solutions. So, I mean, what do you think about some of this pushback? Do you think there's validity in some of these criticisms about the state of digital health?
Well, I think there's fatigue at three levels. So let's just be clear about that. There's fatigue at the consumer level, because they're being hit with sometimes 5, 10, 15 different point solutions, and they're confused. And on top of that, they've got direct to consumer advertising on television, and they've got complex plan designs with different providers with different reimbursement. So there's a fatigue at the consumer, employer, employee level. Employers have fatigue because they're seeing all these multitude of solutions, and all of them claiming the same results. And I think that's going to force. We're already starting to see consolidation there. And then there's fatigue at the payer level, the person who has to integrate these point solutions for an employer. So fatigue's a real thing. And what's really putting pressure on the system to find a way to consolidate, how do you simplify, streamline some of these solutions? I think the winners are going to be the navigators. And they go, Newtopia, Grand Rounds. I mean, there's a whole bunch of players that are really trying to help be that front end, that effective front end that allows you to help navigate. I mean, Quantum and Accolade. I mean, there's a bunch of people who are doing that, but that's only half the battle. So one is that how do we integrate and help a consumer make sense of all this stuff and be that navigational arm? But then there's the other thing that we've only come to realize lately is to engage them and navigate them is only half the battle. The other half of the battle is we have to actually get them to engage in behavior change, because you can navigate them, coach them, give them transparency and all that at the end of the day. But if they don't lose any weight, if they don't get their blood pressure under control, then you really haven't accomplished much. And so I think this tipping point that we're seeing is actually valuable, because I think there's going to be much greater focus on this navigational component, and there's going to be much more focus on, are we really driving effective behavior change? And so it's going to be interesting to see how the players evolve. Just like on the behavior change, we've seen Newtopia sort of come up. On sort of the pure navigation, the folks like Accolade obviously are making a lot of noise. What I think they're going to do is I think they're actually going to come together, because I think that's where you're really going to have the right impact.
How much do you think aligning incentives with that is either playing a role or going to play a role? Like, I mean, you've mentioned Newtopia a couple of times, and I'm familiar with them and their business model. I talked to their CEO, Jeff Ruby. I mean, he talks about they're at risk, 100% at risk. And then there are other companies like Navigator type companies like Transcarent, they're at risk, but like Accolade is not. So like, how do you see this kind of working its way out? Do you think that the, part of this friction that's being felt, in terms of like that sensation of, it's like, you can lead the horse to water, but you can't make it drink. It's like, if the incentive is aligned, like, what are your thoughts on the way that incentives are starting to shift?
We're absolutely going to value-based. I mean, so there's no doubt about that. I mean,
that's it. Absolutely. Mic drop.
They are. But having said that, the thing that's really driven some of that, I think employers are a little, there's PM fatigue, where they just, everybody wants X dollars, per member per month, and there's like no accountability.
Right.
And so I think that we're going to see move to risk in terms of outcomes. And ultimately, we're going to see full cap, so we're going to see, it's not going to stop at just putting your fees at risk. It's actually going to keep going and say, you're going to own the costs and outcomes of a population. So I think you're going to find the navigators are going to have to step up, probably through some kind of consolidation. So where you're actually managing, say, all the diabetics to an outcome. And I think that's where it's going. I think it's moving that way pretty quickly. And it's really going to come with a consolidation.
Yeah, I feel like we've been seeing a lot of M&A, especially this year. I mean, you mentioned Grand Rounds earlier. They acquired Doctor On Demand, and then another startup called Included Health that's focused on LGBTQ.
Sure.
But I mean, I think it's interesting. It's from your vantage point as you're looking at this, from your role as an investor. I mean, so some of these companies that are coming at you with that traditional PMPM model. I mean, like, is it possible for them to change into more of a value-based type at-risk situation, or do you think that sentiment is a little bit lost on entrepreneurs?
No, they absolutely do get it, and actually, that is going to be the expectation. It all starts with doing impact analysis, where you show, if we implement this program in this way with this level of engagement, how do we think we can move the needle on economics? So now you actually have to prove it. So you have to have your impact study up front. And then the next statement from the employer or the payer or the consultant is, Well, gosh, that sounds good. Well, why don't we put your fees at risk to accomplish those outcomes? And this is where it really pushes you to move beyond navigation to actually evidencing behavior change, habit change, which actually results in a lower, HbA1c or, lower all BMI or blood pressure. And that's organizations like Newtopia, for example, are in a position where they can drive those kind of results. And so when you see the collaboration and consolidation, we're going to see much more interest in companies like Newtopia because they're the people that actually can drive that sustained behavior change. And that's where the savings come from. And it's not just in wellness programs. If you look at things like Transcarent, where they're trying to drive centers of excellence, they actually have to get people to go into those centers of excellence. So you can't just have a great center of excellence program, you have to drive adoption into those programs and the results as a result of getting people using those specific providers. Just like with wellness and Utopia, you've got to get those people that have a high average BMI. You actually have to demonstrate weight loss. So that's to demonstrate blood pressure reduction, which demonstrates that you've got a lower HbA1c. So.
I mean, it's interesting to hear you use those examples because it's not only like that whole idea of navigation, but it's like, and the behavior change is not only on like healthy behaviors, to lead to a health outcome, but also like my behavior as far as how I'm accessing the healthcare system. I mean, so this is like conceptually being applied in a couple of different places in healthcare.
Absolutely. Because behavior change is you got to get smarter. I mean, there was this whole movement around transparency. Remember that a few years ago? Yes. And with Castlight, it's all about transparency. Be giving people the numbers, they're going to change. And it kind of helped, but it really didn't. When your doctor says, gives you your first opinion and says you need to do this, and you don't ask any questions, you go do it, and then you wonder why you have a bad outcome. I think part of it is we have to have the influence on the consumer. The consumer actually has to change the way they interact with the healthcare system. Starts with wellness. But as you age and have more afflictions, it's also the way you interact with the system and how you're smarter about how you make decisions.
I'm curious to pick your brain along these same lines here. This is pivoting just a little bit, but I feel like we've been seeing a lot of investment in like a collection of startups I'll call like the digital front door startup. So that's like, whether they are like the chatbot symptom checker that, gets you in and routed to whatever point of care, or if it's like the telehealth solution that you go to first and it's a primary care doc that shepherds you on, or like whatever it is, there's like a range of these digital front door solutions that are out there. Everybody is fighting for this front door. Who do you think wins this? Is it like an incumbent with a digital health, something strapped on the front of it? Is it a health plan? Is it a health system? Is it a digital health company? Is it a telehealth company? Like in the fight for the digital front door, what do you think is going to be important in terms of who wins?
Well, I think that there is a need for a front door, not 50 front doors.
Right? Everything can't be in the front door. You want to go out the side window.
But there has to be somebody up front that can connect with a consumer, connect with a patient, and help gain their trust, and then help guide them, through this complex navigation of improving your health and being, and dealing with your healthcare needs. And it requires a greater sensitivity, personalization, and we're just starting to see it now. And this is, you mentioned Included Health, which is the LGBTQ company, but whether you're looking at disadvantaged populations or women or whatever, just being really respectful for that individual, gaining their trust, and then delivering care consistent with their beliefs, their preferences. I mean, I was reading the other day about if you have a Black mom and a woman, OB/GYN of color, that the outcomes are demonstrably better, when you have that kind of interaction. And so I think being culturally sensitive is going to be really important, but it's beyond that. It's just being sensitive to the unique needs of each individual and then responding to them and not trying to give them a one size fits all solution. I get annoyed when I hear the term population health, like there's some big
Ooh,
uber.
why? Tell me why.
Well, because population health implies that there's one kind of, master common denominator for everybody. And I'm not buying it. I think you've really got to be incredibly sensitive to what the individual's needs and biases and background and all of that. And only then by understanding them, being sensitive to them, understand how to help guide them and help encourage them to make better decisions and make the right decisions. And it's complicated. That's why I say we're in the third inning of all this. I think, and that's the part we have to figure out. If we get that right, that's going to make a huge difference. And then once you figured out to engage them, then you got to get them to change too, which is the behavior change piece.
Right.
But I think it's really the two coming together. It's going to really make the difference. So.
All right, let me pick your brain about employers for a second, because I don't know if our viewers are remembering, but at the top I said you co-founded the Employer Health Innovation Roundtable. And so I know you've got a lot of background there, and I'm sure too with your work with Jiff and Castlight and everything, that population health world is something that you're familiar with, right? But I mean, so talk to me about employers today. I mean, like they have been put through the ringer through this pandemic, and now we're re-entering the workforce, and in some cases, their employees are not coming with them, so it's like, how important do you think, or what do you think the impact is going to be on the way employer health benefits are designed, as a way to attract and retain talent? Do you think that's going to have an impact?
Well, it's interesting. The whole world's been kind of turned upside down. People, they invest all this money in on-site near-site clinics, and then, nobody goes.
All of a sudden, there you go. There is no.
And then they had to figure out how they pivot those to virtual. So I think they are trying to figure out how to do it differently. But you bring up a really interesting point, and it's really, I call it the convergence of talent and benefits, because now all of a sudden employees don't necessarily want to come back to work, or they don't want to come back to the office. And this war for talent is really a big deal. And I think employers are being a hell of a lot more thoughtful about how do we design and deliver programs that are going to really get their interest, get them excited. The one I kind of joke about is the number of employers that talk about pet families. Go figure, so all of a sudden,
like a fur baby, like fur mom, fur dad, like they have a pet family. Okay, got it.
yeah, it's a big deal. But I think it's representative of what employers are thinking about. How do we get our employees engaged? So there's a lot of thought about resilience and engagement. And then how do we then help them navigate? How do we help them be more productive? How do we get them to be more resilient? So I think you're onto something. I think this whole COVID thing is really illustrate just how important it is that you have an engaged workforce, that you demonstrate as an employer you actually really care about them and their success, and they're just not just a unit, they're just not a screw in the machinery. They're actually they're adding value. And so I think that's a trend, and I think we're going to see a lot more focus on that going forward.
What are you hearing from them about the health of their employees? Because it's like, everybody joked around early on in the pandemic about the COVID-19, meaning like the COVID-19 pounds that they gained. But it's like, there's truth to the fact that a lot of folks have experienced weight gain through the pandemic. A lot of folks are, experiencing, mental health issues they may never had before, or that have been exacerbated, things like anxiety and depression and sleep issues, and then, further up the scale in severity. So what are you hearing from employers, or some of the investors? Maybe give us some gossip around what you're hearing about the level of interest in that. I'm really curious how that's going to pan out in plan design coming in like 2022, 23.
Well, it's facts. You just nailed the facts. The fact is we've seen significant weight gain across the population during COVID. Fact. People are much more sedentary. Fact. That we've seen as a result of that, and just the stress of working from home. And particularly moms, you look at the number of women who've left the workforce. What is it? 7 million women or something have left the workforce.
Right. You talk about the impact on benefits there, right?
Yeah. And so it really has had a profound impact. And the stress levels, you see it in MSK, I was talking to somebody from United just talking about the type of back injuries they have for people sitting in front of, screens like this all day long. And
on the wrong kind of chair.
You're talking about, posture, and helping people improve their posture and how that contributes. And I think the stress level is really hard. I think managing work family has been really challenging. And you see it in mental health claims, you see in substance abuse claims. So we're starting to see a significant spike in claims. And that's why you're seeing so much interest in these carve out, mental health companies, from Ginger to Lyra to Quartet to, all those companies.
All the big names.
Yeah. But you're seeing a lot of interest in them, and they're trying to figure out, how do we deal with it? A lot of talk about resilience. How do we create a more resilient workforce? How do we rethink EAPs, the employee assistance plans? So I think that there's a whole bunch of interest in that area. And I think that, you're going to see even more investment there and more of an employer focus on that. I think also on women specifically, there's a lot of interest in women's health.
Okay.
And that really, it's more than fertility programs. I'm not just, I know that was the rate.
Say more, because I think that's where most people in their bucket is like, oh yeah, period tracker fertility program. Got it. Like, okay, so say more about women's health.
Yeah, it's really more about programs that provide more holistic, broader, more support, and really unique, really address women's specific health needs. I mentioned before Origin, which is women's PT. I mean, just just different kinds of programs really were designed by women for women, and it's really interesting. Benefits used to be a male-dominated space, and it absolutely is not. If you look at the HIR, the majority of our members are women, and it's a much more diverse group. And I think the programs that they've been presented with are, up until quite recently, dominated by middle-aged white guys. And we're starting to see, or young, or maybe even younger, entrepreneurs in the Valley. But now we're seeing many, many more companies that are being brought forward by individuals of color, LGBT, and women. And they're doing a much better job in sort of highlighting the issues and helping employers do a better job to attract or retain that part of their workforce. So I think that trend is absolutely continuing.
All right. I'm going to ask you if there's anything that you're not hot on anymore. Anything that you feel it has either peaked and it's done from an investment standpoint in health tech, digital health, telehealth. Is there anything that's over, or do you think we're still climbing?
I think we're still climbing. I think if you don't have a value prop and you can't evidence it and you're not prepared to take risk around it, good luck. I think anything that's built in, they will come. Particularly, I'm speaking as an investor. The first thing I want to see is demonstrate you really got a problem I care about. Really demonstrate that you've got something that's different, that you've got a team that can execute, and demonstrate to me that you've got a path to traction, whether it's with employers or advisors, that give me confidence you can get there. But build it and they will come is absolutely dead right now. And for a long time, I think there was a lot of people who had very cute apps that were kind of interesting and maybe, was clever. But, I don't need the 10th gut health, EHIR. I don't need the 10th gut health, company, as an example. I don't mean to pick on gut health, or the 17th telehealth company. I think that this notion that you need to be really thinking more out of you need to be more innovative. We don't need the fifth of anything.
Right.
And I think that, I guess I'd say that's pretty much dead. And I also think that you better be thinking about a complete solution. A lot of people have really niche things. I think niche things are dead. I think people want to see, how is this part of something that's more comprehensive? How is this going to integrate into existing solutions or workflows? So I think the niche, super niche stuff, I think is on the way out, and those that really bring those things together, consolidate, and again, getting back that support true navigation, support behavior change. Those are the broader kind of themes that I think we're going to see. And mental health, all things mental health, I think are going to be in the fore going forward.
All right, last question for you, because I just have to ask it. As an investor, from your perspective, you were, and also as an entrepreneur who's been there before, right? You
Yeah.
worried about Amazon getting into this space, or Walmart or Apple or Google? Like, I mean, I feel like these big companies have tried multiple times, haven't hit success, but they're coming in a different way this time around. So what do you
Yeah.
think? You worried about those?
I'd be careful because there was that horrible article about Apple that I thought was a cheap shot.
Really?
Week. I've seen the same things about Google, same things about Facebook, same thing about Amazon. I'd be really careful about counting them out.
Okay.
We're doing a lot on the technology side that I think is quite valuable. So I think Amazon, obviously, and if I was a PBM, I'd be worried about Amazon. If I was looking at AI and how you can use big data sets to help identify earlier and treat more effectively, I think Google, they got a lot going for them.
Yeah.
Apple's got more real estate than anybody on the planet. When you look at your watch, your phone, and your laptop, they're going to be around. And by the way, I think they're going to be the acquirers. And I think that, but I think just everybody will all the press likes to take shots at them. And I'd say it's a little early to be taking shots at them. I think they're going to be around for a long time. And I think they are going to play a major role. I put Microsoft in that as well.
All right, cool. We'll have to see what happens. We'll check in with you when your predictions come to fruition here, Larry.
We'll see.
We'll see. Well, thank you so much for joining us. I always love talking to people who have this broad perspective. I mean, not only your past as an entrepreneur, like I said, co-founding Jiff, getting acquired, but like also where you're at today, because you have like a longitudinal perspective on what's happened in health tech throughout the years and how it has gone through these ups and downs. So it's just great to be able to hear your perspective on what's happening now. And some of us who just got to the party are like, this is great. Appreciate you stopping by.
Thank you.
Thank you so much. Larry Leisure, everybody. He is a co-founder and managing partner at Chicago Pacific Founders. You can check out more interviews with the who's who of health tech like Larry over there over at my website. It's youtube.com/WTF Health. We'll talk to you guys real soon. Thanks again, Larry, for dropping by. We'll talk to you later. Bye.